our May 2021 Daisy Nurse Award. We had multiple nominees. As you all know, Daisy is a national or international organization that recognizes that extraordinary nurse, that one that goes above and beyond. It deals with, the Daisy recognizes programs that honor the superhuman work nurses do for their patients and family every day, wherever they practice, in whatever role they serve, and throughout their careers, starting from nursing students to lifetime achievements. So, we had the following nominees: Diane Asmussen, Greg Simpson, Heather Hines, Becca Tilchin, and Travis Felder. They are from 4, 5, and cardiac cath lab. Also, our nominee was nominated as Cassie. She is our Daisy winner. This nominee leads by example. A nurse who's consistently functioned as a skilled clinician, a true patient advocate, a dedicated mentor, insightful educator, and a sensitive caregiver. The nominee is a team player, and co-workers feel working with him or her is a gift. Furthermore, the nominee pays close attention to the emotional and psychological needs of the patient. Each patient is treated as a human being who has a personality, a history, a time of good health and strength, value, and dignity. Here is Cassie's story. Cassie consistently delivers exceptional and compassionate care to her patients. In addition, she is always willing to jump in to help a fellow nurse, no matter what the situation. As a labor nurse, having a nursery nurse I trust with me during a challenging delivery is so important. And whenever I see Cassie walk in when I'm having a difficult time, I take a big, deep breath of relief. On multiple occasions, Cassie has come into the room to help me with a laboring mother or a postpartum patient. During emergencies, she is calm and collective and knows exactly what to do. In one incident, she came in as a backup nursery nurse while I was helping a patient without an epidural get through the delivery. When the patient was crowning, she began to thrash around and try to jump off the bed. Cassie immediately rushed to the bedside to help me calm the patient up enough to deliver the baby safely. Without her quick intervention, the patient might have hurt herself, the provider, or the infant. In another situation, a postpartum mom began to breathe heavily. When the provider went away from the unit, it was up to the labor nurses to keep that patient stable while the doctor arrived. Without hesitancy, Cassie came into the room with a hemorrhagic cart and tray, extra fluids, and a scale to weigh blood loss. She helped me and another nurse start a second IV, order blood, call and direct the rapid response team, and communicate with the provider. With her assistance, we were able to control the bleeding until the provider arrived. The patient received 2 units of blood without any time wasted. The next day, the patient felt good enough to walk the halls. Without her help, the outcome of this situation may have been very different. In addition to jumping in to help the labor nurse, Cassie does an amazing job handling emergencies involving her own patients. She effortlessly directs everybody involved, explaining what to do in clear, concise terms. Cassie's ability to think and act quickly, her compassion for her patients, and her willingness to help in any situation has made her an invaluable part of our team and has resulted in positive outcomes for our patients under her care. Congratulations to our Daisy winner, Cassie. Yay!